Welcome friends, welcome back to the Gluten Connection. This is the second program of 3 and I am very excited to be able to present this one to you today. Now, the title of today's lecture is But I Am Not a Celiac. That's one of the things that I hear quite often. I am not a celiac, so therefore why would I need to abstain myself from the consumption of wheat if I had to. Now, in the previous lecture, we gave you a little history of wheat, and we discovered that in the last 50 years, the wheat of today has become something of a strange foreigner to the human body, something that was not present in human history until 50 years ago. Okay? Now, just remember though that these seminars are just presenting available information to the general public, okay? And they are not designed for particular cases. And you can visit us at newfootsteps.com.au for if you're looking for a consultation. We do international consultations by Skype. Now, studies reveal that 1 person in 100, roughly, is celiac. Up to 42% of people have some kind of trouble digesting gluten. Now, we're talking about just the digestion here. Anything that you can actually think of related to gluten that is affecting you here, just your digestion. So just digestion issues, up to 42% of the people. So in this room, basically that half of the public, in numbers at least, in percentage, will have some kind of reaction consuming gluten. And the thing is that you might not even know about it. Sometimes it's by removing it and then introducing it again that you realize, oh, that's the difference, okay? Now, we're talking about 1 person in 100 celiac. So basically, when we look at in the United States of America, for instance, is 1 in 100. In Canada, is 1 in 133. In Italy, basically 1 in 100. Ireland, 1 in 100. Australia, 1 in 100, and the United Kingdom, just about the same, similar percentage, okay? Now, when we're talking about gluten-related disorders, we need to differentiate what we are actually talking about. Now, you don't need to be celiac to actually have some kind of reaction to gluten. So, we separate it in this way. You can have an autoimmune response to gluten. In other words, you are reacting from within, and that reaction is not just against the gluten that you're consuming, but that reaction is even against yourself. So you are attacking your own cell. Okay? You can also have an allergic reaction. You can consume wheat, for instance, and have a reaction. And the reaction can be in the skin, or in other parts of the body, or build up sinuses, or many other reactions that you can have, okay? And you also, and this is the tricky one, you have the no autoimmune, not allergic reaction. So in other words, you don't have an autoimmune reaction, and you neither have an allergic reaction, but however, you still have a reaction. That's the tricky one. That's the one that will say to you in the test, no, you are not celiac. I had many people that said, good news, Oscar. I said, yep, I've done the test and the test says negative. I said, oh, fantastic. That's great news. So when you go home, you eat bread, how do you feel? Bloated? Oh, so which one is the real test? The one that says negative, or the one that if I eat that plate of pasta, I'm just like, whoo, all bloated? Which one is the test? Now, when we're talking about autoimmune, we're talking about celiac disease. And of that celiac disease, 1% is symptomatic. What does that mean? 1% has been diagnosed and they have symptoms. Now is when it becomes tricky. 1%, 1 in 100, they have symptoms. What are you talking about? Can you be celiac and not have symptoms? Yep. You can actually be a silent celiac. You can actually be celiac and you miss all the tests and nobody's able to diagnose it, and they misdiagnose it with things like fibromyalgia, or they misdiagnose it with lupus, or misdiagnose it, for instance, and we'll talk about it in later on, with schizophrenia. Schizophrenia? There is a small number of people suffering from schizophrenia, a small number, and the studies are consistent. Not all schizophrenia is caused by gluten or gluten as a contributor, but there is a small percentage of people with schizophrenia that in reality, what is causing all the trouble is the wheat. And you remove the wheat, they stop hearing voices. You add the wheat, the voices come again. Now, it's a small number of all cases of schizophrenia, okay? But what about if that a small number is your son? That would be worth it, isn't it? Okay? So, notice silent or misdiagnosed, and then you have potential just with celiac alone. Just with celiac alone. Then you have gluten ataxia. What is gluten ataxia? Anybody knows? Any idea? No? Okay, gluten ataxia, you know what ataxia is? When you're losing your balance, you're losing your equilibrium, okay? Now, I am not saying that every time that you lose your balance is because you just ate a plate of pasta. I'm not saying that. But there is a condition in which the person will lose the balance if they consume gluten. So if they consume gluten, it affects their balance. You tell me what your balance has to do with your gut. The balance is controlled here. What does it have to do with the gut? It appears not much, isn't it? So hold on a second, we're moving away from the gut, but we're consuming something, and it's affecting my equilibrium. Now, again, if you're losing your equilibrium, don't think, oh, it must be the gluten. You need to be diagnosed with gluten ataxia. And then you have, for instance, dermatitis epiphthalmis, okay, issues in the skin. Now, when you have an allergic reaction, you might have a wheat allergy. But a wheat allergy can be manifested in a number of ways. How will a wheat allergy be manifested? You can have a skin rash when you eat, okay? You start getting rashes when you eat it. But, for instance, you can have a respiratory allergy that is actually linked to the wheat allergy. Tell me of a respiratory allergy. Asthma. Asthma, for instance. And in some cases, you remove the wheat, you remove also the lactose. You remove the wheat and you remove the lactose, and by doing so, the person's asthma improves. So the person actually breathes better. The sinuses work much, much better. You can have a food allergy. Now, if the wheat allergy is serious and true blue, it will actually do damage in your gut. As that gut gets damaged and you end up with holes in it or hyperpermeability in the gut, all of a sudden now all the foods with their proteins will get in and will cause reaction. Eventually you'll have reaction to everything. And I've seen it. I've seen it in the clinic. People that started just reacting to one thing and they continue, and then to another thing, and then they were just doing an elimination of what was causing that reaction, and basically everything reacts now. Why? Because you created damage, and once you open the gate of that damage, then all the proteins and compounds from other foods start reacting in you. So sometimes by getting rid of the biggies, sometimes you also get rid of the small reactions. You following? Okay. So you have that particular condition, WDEIA, and it is a condition in which you start having issues with gluten if you move after you consume them. So it's involving movement. So if you eat your plate of pasta and you don't move, you are fine. If you just go and follow my counsel in the weight connection seminar and you eat and you stand up and you go for a walk, you start having problems. So it's related with your movement, believe it or not. Now, do not use this excuse, gentlemen, to not to do the dishes after dinner. You know, say to your wife, sorry, I've got that condition, you know, if I move after dinner, I get sick. Honey, can you do the dishes? No, it's not working. Contact urticaria. I shake your hands and I get all itchy just because I shook your hands, for instance. Now, one of the things that we see often is when the person tends to eat a nice big plate of bread or pasta, wheat-containing produce there, and after eating, fall asleep. Okay? So, again, some husbands might not like to get rid of that condition because that gives them an excuse to skip doing the dishes. Okay? Now, and then we have the non-autoimmune, non-allergic, innate immunity. This is the non-celiac gluten sensitivity. You are not celiac, as the title of this lecture started with. You are non-celiac, but you still have sensitivity to wheat and gluten. Okay? So, for instance, right at the top to your left is a healthy small intestine, the upper part of the small intestine, with most of the absorption happens. And you have those projections there, the finger-like projections. And those are filled, or ought to be filled, with bacteria. Those of you that have watched the Bacteria Connection, you will remember me saying about that bacteria is needed to break down food, to even help with the assimilation of food, etc. So that bacteria is all surrendering and populating those finger-like projections. And those projections has different foldings. If you were able to unfold all those projections and spread it over, you will actually end up with something like this. Over a tennis court of absorption mechanism. That's your absorption mechanism. You have over a tennis court to absorb your nutrients. However, going back to that slide, the one at the bottom has been damaged, and has been damaged in this particular case by gluten. Okay, so if that person gets a biopsy of that area there, of that section, they will confirm celiac in this case. And you see all the projections, all the finger-like projections have been like shaved off. So that means that your absorption mechanism has been eradicated or minimized. So are you going to have issues with malabsorption? Of course. You're just gone from a tennis court to a small tennis table. So you are going to be compromised in your iron absorption. You are going to be compromised in your mineral absorption. You are going to be compromised on your vitamin absorption, your protein absorption, everything else, because you have reduced the area by what? By doing the damage. And the damage in this case, in this scenario, in this context, a damage that can be done by the gluten. Okay? So, there is something called gliadin, the gliadin factor. Now, when we're talking about gluten, we need to understand that gluten is not just one protein. Gluten is a whole range of proteins that form gluten. Okay? So, one of them is gliadin. In fact, one of the tests that is done to confirm your diagnosis will be the IgG test or the gliadin test. Okay? Just looking for gliadin antibodies. In other words, gliadin is doing a damage and your body is reacting to it by creating antibodies. Okay? And they're looking at the levels of those antibodies. Gliadin causes an immune response in all individuals, creates intestinal permeability, or what we know as, in the urban language, leaky gut, and has pharmacological properties. Now, pharmacological properties will have an effect where? In your brain. Okay, if you take drugs, the last thing that you are concerning of is how that drug is affecting your gut, but rather how the gut is affecting your brain. So pharmacological properties of gliadin. Besides that, the digestion of gliadin produces a peptide that is 33 amino acid long and is known as the 33-mer. So, for instance, let's say that this is the internal lining of your gut. These are epithelial cells on one side, these are epithelial cells in another. They're nice and tied up together through junctions. Nice, tied up together. So the food is going through the middle of my fingers, okay? Now, the absorption mechanism says that the nutrients that I need to absorb will have to go through my nails. In between my nails, there are actually portals and transporters for minerals, for amino acids, for fats, etc. Some go through osmosis into the body. Okay, so let's say they go through my nail, through the middle of my nail. What happens? That gliadin does this. That's called leaky gut. It just separate the cells. Okay, the junctions are being broken and this separates the cells. So now I've got two ways in which my nutrients are going to come inside my body. I've got the nominated way through my nails in this case, or through the middle of my fingers, or in between the cells. In between the cells now we can have large peptides coming in. Now those large peptides, they are form of amino acids. Okay, so the body in the normal situation, in the normal stage, without any damage, will absorb through amino acid transporters 1 or 2 amino acids at a time, not 33. That's entire form protein, and it won't get 33 unless it can go through the middle, in between. Now, that, for instance, in this case, the 33-mer has a code of amino acids. Okay, there's a number of arrangements of amino acids all throughout. Let's go to think that arrangement of 33, each one a different amino acid in a different combination, has a color code. Okay, it's color coded. So you see 33 amino acids in a color code. Okay, so there's a red here, 2 reds there, and another red there. There's a yellow here, another yellow there. We got a green, 1 green at the end, etc. All up a 33 color-coded peptide. All right? And now that fella has actually gone in the back way. It's going now into your blood system. It's traveling around. The defense mechanism of the body says, hold on, we need to create an antibody to get rid of that fella. The alarm sounds, there's intruder inside, it should not go in, and it's in. So the antibody, it just hooks perfectly with the 33-mer, for instance. And then it takes it to the liver, dismantles it, and end of story, right? Now, you have policemen inside your body, and those policemen, they go with a torch. And those policemen with a torch, they start looking inside, looking for that color combination, color code of 33. Now, imagine with all the commotion there, that policeman with the torch is just going there and say, hold on a second, that's the red. That's the red, yeah, okay. That's the yellow, oh yeah. That's the green, yeah. It's in here! And here comes the antibody, and he just attacks that thing and disattaches it. What's the problem? The problem is that section of 33, it was exactly the same as the code for the 33-mer. But maybe it wasn't a 33 amino acid, maybe it was 150. But just that section was just like the 33-mer. So if it's not the 33-mer and it's inside the body, what is it? It's you. It's your own tissue. It's your own cells. It's your own, because your cells and your tissues, they're formed by proteins. So the body is attacking who? It's attacking you. It's interesting because in Australia actually was a number of epidemics in child care centers for the, I cannot pronounce that word properly, whooping cough? Whooping cough. Okay, a number of epidemics. Now, guess what? The 33-mer has a remarkable similarity to the internal sequence of protecting the immunodominant sequence in the Bordetella pertussis bacteria, or whooping cough. So if you have a child that has a leaky gut and the 33-mer from gliadin is continuously coming in, that one has a very close resemblance to the whooping cough bacteria. It is interesting because it comes a point in which the body doesn't know which one is which. Which one is the enemy and which one is the friend? I mean, that guy is eating it every day. And maybe the real one comes and the body is exhausted and it cannot recognize the difference. And then, despite the fact that that child has been immunized, because in most cases, in these epidemics that happen in Australia with whooping cough, guess what? The children were immunized against whooping cough. They already had been immunized against it. So, interesting. Now, then we have the lectin factor. So when we're talking about gluten, and now lectin is something that we sprinkle over the cereals. We call it wheat germ. You know, wheat germ that we sprinkle over the cereals because it's a good source of all the good things. Now, the wheat germ, or the lectin is contained in the wheat germ. Selective breeding has made the wheat germ quite unbreakable for the digestive enzymes of many individuals. Now, everything has lectin in it. Your skin has lectin in it. The tomato has lectin in it in the skin. The cucumber, the chicken, the egg, they have lectin in it because lectin is a natural insecticide. Okay, so the reason why you don't leave this place today and get eaten by insects is because you taste disgusting for them. Your level of lectin tastes awful to them. So you are not sweet for them. You're very, very bitter. So every survival, as a mechanism of survival, every plant and animal has a level of lectin to make sure that that seed will be enough seed for next season. So the insects and the grasshoppers will not get rid of it, okay? What we have done now with hybridization in the last 50 years is that we have increased the level of lectin to levels high above anywhere near the historical record of wheat. So we have increased the insecticide level of wheat. The toxic level of wheat has been increased dramatically. That's how we get the pest-resistant varieties. You know what the industry uses lectin? Have you heard of the cockroach spray? Yeah. That you put around the corners of your kitchen, etc. Guess what they have in it? Lectin as one of the main ingredients. Because it's a natural insecticide, but it's now been accumulated and concentrated in high levels. And we have it in high levels in the wheat of today. Okay, so one good thing is that as you are eating the wheat of today, you won't be bothered by cockroaches. Okay, so this glycoprotein has been identified as responsible for causing direct non-immune mediated damage to our intestines. Not immune mediated damage. So in other words, there is not like an immune response to it, to our intestines, and subsequent to entry into the bloodstream, damage to distant organs in our body. So distant organs from the gut that are not related to what? To the digestive system. So all of a sudden, I'd have to look beyond the gut to see if I got a problem with wheat. I cannot just rely on the gut, because some of the elements that are making the damage are doing damage beyond and far distance from the gut. Are you following what I'm saying? So in fact, the Lancet, which is a very respectable medical journal, said the following to practitioners and to physicians. To improve diagnosis rates, the perception of physicians that gluten sensitivity is solely a disease of the gut must be changed. Now, do you know who these people are, the Lancet? They reckon now there is the second most prestigious journal. They will say themselves to be the first one, but they're not. They are the second, or maybe nowadays the third, okay? But they're very, very prestigious, very, very prestigious. To publish in the Lancet, you need to be a very top of the class science. You have to have so many papers reviewed, so many publications already established in your bag before you get even considered to be published in the Lancet. And they're actually saying that to improve diagnosis rates, physicians and doctors, they need to actually look beyond the gut, beyond the symptoms of the gut, to see if there's an issue with gluten and with wheat. So for instance, now what I'm going to bring here is gluten a contributor in these cases? Now, what does it mean by a contributor? It doesn't need to be a precursor. It doesn't need to be gluten causes this, okay? It doesn't. But what gluten might be doing in some of these situations is just exacerbate the condition, make it worse. So for instance, here they're not saying that epilepsy is caused by gluten, okay? And by the way, it's published in the Lancet, okay? They are not saying that epilepsy is caused by the gluten, but they're saying that if you have epilepsy, the gluten might make it worse. Are you following? Now, we know, for instance, that right at the bottom, the canker sores, they're caused by a virus, okay? But if you have the gluten, you're going to have more flare-ups of the cold sores, okay, because of the gluten. Are you following? They're not saying that the gluten causes canker sores, but they can be a contributor of a worsened condition. You following? So here we got, for instance, recurrent headaches, nervousness, migraine, epilepsy, dizziness, constipation, heartburn, canker sores, and these are the lists provided by the Lancet, okay? Overweight. Now, when we think of celiac disease, what are we thinking of? Oh, underweight. But now is overweight. It's just the opposite. Because it is actually now recognized that wheat can be one of the factors of obesity, especially the wheat of today, that rises up insulin levels way too high in some individuals, okay? Now, in my case, I should mention, in my case, my middle daughter has a sensitivity to wheat. And it's not a strong sensitivity. She can be without wheat for a while, and then she can eat it once in a while, and she'll be fine. But if you give her 3 days in a row, she will start complaining of tummy ache. She's 14 now, okay? When we stop her from the wheat, which she must have been maybe 4 years of age or something like that, but about 10 years ago, my wife stopped too, and in fact, I stopped too because I didn't want, she is the middle daughter, I didn't want her to be the green dog in the family. So we thought, okay, well, we'll just make it natural, all of us do it. Now, I have to say that I never, in my case, considered wheat to be a problem. And my wife doesn't like me because I can eat anything and I'm fine. She can just go a little bit of her diet and she feels yucky. So she says, it's not fair. You know, you can eat anything. Well, I have to say that in my case, I didn't see much of a problem eating the wheat. Mind you, when I got to Australia, I stopped almost eating bread because the bread did not taste like the Spanish bread. Spanish bread has different flavors. In Australia, the bread is one type of bread with different shapes. The shapes are different, but it's the same bread. And I just didn't enjoy it. So that's to be honest, probably I ate less bread because of that reason, but I never actually felt a problem necessarily. But one thing I noticed is that when I stopped eating the wheat, it was easier for me to maintain lean muscle. It was actually easier for me to maintain myself into a healthy body fat percentage. Okay? It was actually easier. I will do less and it will be easier to maintain it. You following that? Okay, so that was in my personal experience. Okay? So we got gastric ulcers. Again, we're not saying that gluten causes gastric ulcers. We're saying that if you do have a gastric ulcer, gluten is going to be making the situation worse, as well as colitis, abdominal pain, gallbladder pain, emotional instability, infertility. And the infertility bit, despite the fact that it comes in the Lancet, I have actually witnessed anecdotal cases, especially 2 individuals, and it must have been pure chance, but they were trying for quite a long time, and she actually stopped with the wheat, and 6 months later she was pregnant. Pure chance. But then I found this in the Lancet. Okay, so abnormal tiredness, indigestion, that one, sinuses, hypertension, hives, skin problems, angina, asthma, hemorrhoids, depression, diabetes, chest pain, gastrointestinal bleeding, nosebleed. Now, nosebleed and my wife, that's the story of her life and her upbringing. Nosebleed, continuous nosebleed. She stopped 10 years ago, and she only bleeds when she's been traveling on the plane, maybe with the pressure, which is not often, maybe once every 3 years, and just for a little bit. But before it was almost weekly. Almost weekly, it would be just, oops, I'm bleeding from the nose. Okay? So that's interesting because in my wife, that was definitely a case, the nosebleed. And I want to mention something about the depression bit. I ran this seminar years ago in my local area in Australia, and there was a friend that came to the seminar. Now, this friend had a friend that was going to be going to a psychiatric clinic in 2 weeks. So our common friend decided that was going to do 2 weeks without gluten with her friend that was going to go to the psychiatric hospital. 2 weeks later, this lady felt so good that asked the doctor if the doctor could postpone it for another 4 weeks. And the doctor agreed to actually postpone the entry. And 4 weeks later, that made it 6 weeks without gluten. She felt even better and said to the doctor, can we postpone it even further? I'm actually feeling good. She was losing weight and she was actually feeling better in the mind. Well, to this day, and to my knowledge now, and we're talking about now 5 years, she has not gone to the psychiatric hospital. Okay? So that is, I know it's anecdotal. I know it's just from my own personal experience. I understand. But depression is listed in the Lancet. Okay? And hemorrhoids and constipation, definitely. We have noticed that. Anemia, of course, you are going to have problems with absorption. Vitamin B12 deficiency, again, that's where the vitamin B12 is manufactured and absorbed, cobalamin. Okay, you need a healthy gut for cobalamin to be manufactured and be absorbed, or even if you, so you have actually issues in the stomach with intrinsic factors and a number of areas and entry ports for the vitamin B12 that you're consuming. Folic acid deficiency, eating disorders, autism, ADD, ADHD, type 1 diabetes, hypothyroidism. Now, gluten does not cause autism. Okay? Gluten does not cause autism. But if you have a child with autism and learning difficulties, gluten might be a contributor of their bad behavior and their lack of concentration and the hyperactivity. Okay? So you don't have a child with autism because you fed him gluten. But gluten might create an issue in their behavior, okay? And we have seen this quite often. You remove the gluten from some of these children, and some of them actually improve just by doing that. And some parents can be now so fine-tuned to the behavior of these children, of their own children, that they know when they've gone through to a birthday and that child has stolen a cookie. And they can know of that half an hour later by the behavior of the child. Okay? So things with the thyroid, of course, inflammatory bowel disorders. How many here know what alopecia areata is? Baldness or early baldness. Okay? It's amazing because men are very, now again, if you are bald, don't expect to quit gluten and all of a sudden you are going to be the wolf man. Okay? It's not going to happen. But what they're saying is that in some early conditions, gluten actually, in some cases, can actually be a contributor. Okay? Malabsorption, mineral deficiency, Crohn's disease. We deal with Crohn's disease in our practice, and guess what is one of the things that we take out first? Gluten. Okay? From Crohn's. Dental issues, dermatitis epidermolysis. Chronic diarrhea. This is actually quite normal. We had mothers that said, oh, there's something wrong with my child. I said, why is that? Well, she's 5, eat something, diarrhea in 30 minutes. 30 minutes, plenty of accidents because the child cannot hold it, and diarrhea. That's quite common. Premature graying, kidney disease, lupus. Now, again, if you're turning white or gray, don't expect that you're going to, because people look at me and they say, man, that guy is in his 40s, so how is it that doesn't have much gray hair? Well, there is a reason for it, and the reason for it is called my grandfather and my father. They are the reason. There is the genetic gene on it. I've got photos with my grandfather when he is in his 70s. And it is an old photo, and it's a long distance, but in that photo, my grandfather in his 70s, and he doesn't appear to have white hair. So there is a contributing factor, the genetics, okay? So now, look at this one. Short stature is one of the most common clinical manifestations of celiac disease and should be considered in all children with short stature. This was painfully discovered by a family that had a son that was not growing. He was always underneath and the parents were not that small. They were average. And in fact, they had all the children, and all the children were doing fine, but he was stagnant growth. He was eating the same thing, but he was stagnant. And so what they gave him growing hormones, growth hormones, etc. They help a bit, but then what they did is they submitted him to a number of operations. They need to break the bone to stimulate growth. So that child had, I think it was when he was 9, and then when he was early in the teenage years, I'm not quite sure about the dates and age exactly, but he had to go through a number of operations where they will actually literally break the bone to stimulate that growth of the bone, okay? Only to discover at the age of 15 that the child was celiac. After all those operations, and after only a very short time period left for the growing, okay? So the child was celiac, and that was discovered at the age of 15. Now, notice this article from CBS. Modern wheat, a perfect chronic poison, says one of the doctors. And look what he says. If 3 people lost 8 pounds, big deal, Dr. David says. But we have seen hundreds of thousands of people losing 30, 80, and 150 pounds. Diabetics become no longer diabetic. People with arthritis having dramatic relief. People losing leg swelling, acid reflux, irritable bowel syndrome, depression, and on every day. Now, I have actually seen I haven't seen losing 150 pounds in my experience, but I have actually seen people losing weight and they could not lose it any other way just by removing the wheat and a few other things that if you watch the Weight Connection seminar will be also beneficial. And yeah, this is actually the experience of this doctor, okay? Now, and this is what I was mentioning before about schizophrenia. Australians were actually the first one. There was an Australian doctor that decided to separate the groups of schizophrenia patients and change their diet, wondering if diet had anything to do with it. Now, to one group, he fed the same amount of food and variety that there was previously provided for them. To the other, he removed the wheat and he removed the lactose. And he saw improvement in overall, in behavior and things like that. But in a number of them, a small number of them, it was a huge improvement to the point in which they stopped hearing voices, they started acting normal, and they actually, and that was because the schizophrenia-induced condition was induced, in fact, by the wheat and the gluten and the lactose, all that combined together. So it was a small number. They repeated that study. A lot of people have repeated that study or similar studies like that. And now, if you go through Google Scholar, for instance, this is an open source for everyone. Now, in my case, I have a university library source for general articles because of that's a lifetime subscription to that. But for the general public, you can actually go to Google Scholar. So you know how you get Google Maps? So you get Google Scholar, and the only thing that you're going to get there is proper general articles, okay? Medical articles and journals. So you just get to Google Scholar, and it works the same as Google, and then you just go schizophrenia and gluten, and you will get different studies. Some are not good, some have a lot of issues in the way they outline the study, but there is actually a number of them that have consecutive results of with the same outcome. There is a number of people with schizophrenia, a small number, that in fact could actually be made better by removing the wheat and the gluten and lactose from the diet, okay? So I'm looking forward to see you in the third and final presentation that says, is gluten-free good for me? So I'm inviting you to please join me in that final one. It gets worse. I'm going to actually bring to you a challenge, and I just want to see if you will be up for that challenge. I'll see you there. Thank you.